Question 1. A 45-year-old woman with systemic lupus erythematosus is started on a new immunosuppressive agent after developing lupus nephritis. 1 month later, she presents with fatigue, frequent bruising, and recurrent infections. Labs show WBC 200 mm, hemoglobin 8.3 grand, and platelet count 55,000 mm. Which of the following best explains the most likely mechanism of action of the drug she was prescribed? A. Inhibits IL-2 receptor signaling. B. Inhibits inosine monophosphate dehydrogenase. C. Alkylates DNA. D. Inhibits nucleotide synthesis as a purine analog. E. Inhibits dihydroorotate dehydrogenase. Correct answer, D. Inhibits nucleotide synthesis as a purine analog. Azathioprine is a prodrug of 6-mercaptopurine, which inhibits de novo purine synthesis, thereby suppressing lymphocyte proliferation. Her pancytopenia is consistent with azathioprine toxicity. Why not the others? A. Inhibits IL-2 receptor signaling, describes basiliximab or daclizumab, not azathioprine. B. Inhibits inosine monophosphate dehydrogenase, describes mycophenolate mofetil, not azathioprine. C. Alkylates DNA, seen with cyclophosphamide, not azathioprine. E. Inhibits dihydroorotate dehydrogenase, describes leflunomide, another immunosuppressant used in RA. Question 2. A 60-year-old man with Crohn's disease is started on azathioprine. He is also taking allopurinol for gout. 2 weeks later, he is hospitalized with nausea, mucositis, and a rapidly declining white blood cell count. What is the most likely explanation for his condition? A. Azathioprine resistance due to increased xanthine oxidase activity. B. Competitive inhibition of azathioprine by allopurinol. C. Enhanced toxicity due to decreased degradation of 6-mercaptopurine. D. Drug interaction causing decreased activation of azathioprine. E. Direct nephrotoxicity from azathioprine. Correct answer C. Enhanced toxicity due to decreased degradation of 6-mercaptopurine. 6-MP, the active form of azathioprine, is metabolized by xanthine oxidase. Allopurinol inhibits xanthine oxidase 6-MP levels, severe bone marrow suppression. Why not the others? A. Azathioprine resistance, opposite of what's happening. Toxicity, not resistance, is the issue. B. Competitive inhibition by allopurinol. No competition occurs. Allopurinol inhibits metabolism, not competes. D. Decreased activation. Activation is not reduced. Rather, degradation is inhibited. E. Direct nephrotoxicity. Azathiopриne's primary toxicity is myelosuppression, not kidney damage. A 52-year-old woman with long-standing rheumatoid arthritis, RA, has experienced inadequate symptom control with methotrexate alone. Her rheumatologist adds azathioprine to her regimen. Which of the following best describes the reason for using azathioprine in this patient? A. Blocks tumor necrosis factor alpha directly. B. Suppresses B-cell antibody production by targeting CD20. C. Inhibits purine synthesis to reduce lymphocyte proliferation. D. Inhibits cyclooxygenase 2, COX-2, selectively. E. Neutralizes interleukin-6 to reduce joint inflammation. Correct answer C. Inhibits purine synthesis to reduce lymphocyte proliferation. Azathioprine is a purine analog that is converted to 6-mercaptopurine, which inhibits de novo purine synthesis, thus preventing lymphocyte proliferation. It's used in autoimmune conditions like RA when first-line treatments are insufficient. Why not the others? A. Blocks tumor necrosis factor alpha directly. This describes TNF inhibitors like etanercept or infliximab, not azathioprine. B. Suppresses B-cell antibody production by targeting CD20, describes rituximab, a monoclonal antibody, not azathioprine. D. Inhibits cyclooxygenase 2, CHOX-2, selectively, describes celecoxib, an NSAID used for symptom relief, not disease modification. E. Neutralizes interleukin-6 to reduce joint inflammation, describes tocilizumab, another biologic used in RA. Would you like